Hello everyone, good evening, very good evening. Today we are going to talk about the RMP and AP. Please let me know in the comments. If you're online, please let me know if I'm audible and visible to you guys, right? It will take a minute or so. So let me know if I'm audible and visible. All right. So we will take just a moment so that we'll see that whether this is coming live or not. All right. Wonderful. So very good evening, and today we are going to talk about the RMP and AP related to all the concepts related to it. Okay, so let's start with the wonderful quote that is, I don't care who is doing better than me, I'm doing better than I was last year. It's me versus me. It is always going to be me versus me, right? So remember that, and no matter where you are right now, you can always improve, right? Whatever happened, it's happened, it's gone now. Don't think about it. Always remember that you have to think about the future. Gulnazi, hello, very good evening. Dr. Reddy, good evening. So let's start with the first concept, that is nerve muscle physiology ka first concept. What is the first concept? That we all know the cell membrane shows partiality. What do you mean by partiality? The cell membrane allows some particle to come in and it doesn't allow some particle to come in. Why does that happen? Because please remember that the cell membrane is made up of phospholipid, isn't it? The cell membrane is made up of phospholipid. Phospholipid is the amphipathic lipid, which is going to have a head part and tail part. And the tail part is hydrophobic. Phobia means excessive fear, isn't it? Phobia means excessive fear. And if this part is hydrophobic, that means it will not allow the water-soluble substances. It will just allow the lipid-soluble substances, isn't it? So semi-permeable means it will allow some molecule or some substance and doesn't allow some. So that means the cell membrane, CM is cell membrane over here, the cell membrane shows partiality. Now you will ask me that, ma'am, all of the ions, they are polar molecule, they have the charges, right? So if they have the charges, how come the diffusion of those molecules are also possible? The thing is, some channels are constitutively open. Constitutively means all the time, right? They are open even during the rest. They do not require any of the stimulus, right? So if that ion channels are open, the ions can move freely even during the rest through and throughout the cell membrane. So please remember, what are those ions? If the ion channels are open during the rest and the ions are able to move across the membrane, we are going to call that those substances as, or those ions as, diffusible ions, because they diffuse inside the cell or outside the cell without any stimulus at the rest. So what are the diffusible ions at rest? Those are nothing but the potassium. Potassium is fully permeable. That means all of the channels are going to be open fully, so that according to its concentration gradient and electrical gradient, the potassium can move. All right. And there is one more ion, that is the chloride ion, which is actually diffusible, but remember, it is not fully diffusible. What I mean by that, that in some parts, the channels of these chloride will be open, and in some parts, they will not be open or partially open. So I can say, yes, it is diffusible ion, but it is partially diffusible. So if they ask, who is fully diffusible, your answer should be potassium. But does any other ion which is diffusible at rest? Yes, it is going to be chloride, but chloride is partially permeable or partially diffusible. Please remember that. All right, and rest all of the ions, they are non-diffusible or non-permeant, right? Diffusible ko hi we are going to use the terminology that is non-permeant or non-permeable ions. All right, so non-diffusible ions or non-permeant ions are rest all, Rest all the other ions, they are going to be non-diffusible ion. For example, give me some examples. Of course, the sodium, calcium, phosphate, bicarbonate, right, magnesium, so on and so forth. Of course, proteins are also, but we are talking about ions, so we'll keep it so, right, etc. So all the other ions, they are not going to be permeable during the rest, which are known as non-diffusible ion. If you understood this much, your work is going to be very, very easy. Now understand, you must have seen the Tug of War. Now what is it? It's a game in which what will happen? There will be two teams. One team is going to pull the rope on one side, other team tries to pull the rope on their side. So whomsoever is going to apply more force, they are going to win the game, isn't it? And we just now learned that at the rest, I'm going to have the potassium, which is going to be fully permeable. So let's take a cell. Let's take a cell. So suppose this is the cell, and let's take the potassium channel. So see over here that the potassium, for now just trust me that whatever I'm teaching is correct. You don't have any option. So potassium is more inside the cell. As soon as the gates are open, what will happen? The potassium tries to go outside. But please remember how much. So let's take the arbitrary number. Let's say over here there are 100 molecules of potassium and outside only 10 molecules of potassium are there. Now what will happen? Overall 110 molecules are there. So till what time the potassium should move outside? Unless and until it becomes equilibrated on both the sides, that is 55 molecules or ions both the sides of the potassium, isn't it? But that doesn't happen. Why? Because this is not the condition which is going to be present in vivo. That means inside our body, only potassium is not there. Other ions are also there, and those ions are non-diffusible. Inside the cells, I'm going to have proteins as well as phosphates. And these proteins and phosphates are both negatively charged ions. So what will happen? As soon as, let's say few molecules went outside. Let's say potassium was more inside, that is 100 molecule, and out of that 100 molecule, only 20 were able to go outside. That means in total, I'm going to have 30 molecules outside, and inside I'm going to have 80 molecules because 20 molecules went outside. Now, at this point, what is going to happen? The concentration gradient, because of that, I'll just write delta C, that is concentration gradient. According to the concentration gradient, the potassium started to move outside, isn't it? But what will happen? That the phosphate and the proteins, they are negatively charged molecules. What they will do? They will now try to pull the potassium inwards. Why? Because in the physics, you all know that opposite attracts, isn't it? Though we do have the laws via the Supreme Court and all the other courts, right, that the homo is also now legal. But remember, that is not going to be applicable in the cell or in the body. Right? So in the body, the physics laws are still, or the laws which are generated by the nature is still applicable. That is, opposites are going to attract, isn't it? So that means opposite charges are also going to attract. So negatively charged, that is proteins and the phosphates, they are going to hold on to the potassium. They will not allow the potassium to go out even more. So now what will happen? That because of this protein and phosphate, which are negatively charged molecules, because of them, what will happen? That there is delta E that will be generated. What is it? There is an electrical gradient which is going to be generated. So please remember, when the electrical gradient and the chemical or the concentration gradient, they are equal but in the opposite direction, at that time the movement of the potassium is going to stop. Remember, potassium molecule wise, it is not equal on the both side even now. Inside I have 80 molecules, outside I am having 30 molecules. It's still having some concentration gradient, but still the potassium will stop going outside. Why this is going to occur? Because let's say this is the team A, team B. Right, team A and team B. That means now the concentration gradient of the potassium and the electrical gradient of the potassium, that is equal but in the opposite direction, and that's why the rope will not go anywhere. And because of that, what is going to happen? Definitely this is the potassium movement which is going to stop. So this point where the concentration gradient and electrical gradient is equal and opposite, this is known as the yes please, this is known as the equilibrium potential. So what we are going to do, we are going to introduce one electrolyte inside the cell and one surface electrode, and we are going to connect that with the voltmeter. Right, and we are going to check that at what point, at what voltage or at what potential the potassium will stop moving outside. That means it is equilibrated. It is equilibrated on both the side, and this potential difference, the magnitude of that potential, is known as Nernst equilibrium. All right, we'll come on to the Nernst, but why this whole scenario occurred? Because there was presence of some non-diffusible ions which were there inside the cell. So please remember, the effect of, there will be effect of negatively charged ion. That means the distribution of the diffusible ion is going to be affected by the non-diffusible ion. So non-diffusible ions, they are going to affect the distribution of the diffusible ions, and that is known as which effect? That is known as the Gibbs-Donnan effect. So please remember, it is either called as Donnan's effect or it is also known as Gibbs-Donnan equilibrium. So please remember, this is also be called as Gibbs-Donnan equilibrium. So please remember Donnan's effect and Gibbs-Donnan equilibrium. How to remember this? Please remember DDD. What is DDD? The distribution of diffusible ions is affected by non-diffusible ion, or effect of non-diffusible ions on the distribution of diffusible ions. In the MCQs, they can give you the effect of non-permeant ions on the distribution of permeant ions. Non-permeant ions, non-diffusible ions, one and the same thing. Diffusible ions, permeant ion, one and the same thing. Alright, so please remember DD, Donnan's effect, distribution. They're talking about distribution and non-diffusible ions. Because of them, the distribution of diffusible ions are going to change. The equilibrium potential is going to be happening because of them. So please remember that. Now, why this whole scenario occurs? Because the concentration of each of the ion is different inside the cell and outside the cell. Let's see which ions are more inside the cell and which ions are more outside the cell. We all know about the ICF and ECF. What is ICF? ICF means intracellular fluid. That means what is the concentration of particular ion inside the cell. And what do you mean by ECF? ECF means extracellular fluid. Extracellular fluid. And please remember cations and anions. How to remember? Cathode and anode, you tend to get confused between cathode, anode, cation, anion. What are they? Which one will be attracted to cathode? Which one will be attracted to anode? Don't worry about all those things. For now, just remember, cations mean T is coming and T looks like positive, right? So that means cations means positively charged molecules or positively charged ion. Anions may N is coming. So that means it is the negatively charged molecule. Negatively charged molecules which are going to be called as anions. So let's see in the ICF who is more, in the ECF who is more. When I talk about the cations which are more in the ICF, they are none other than your potassium. Just now we saw that, and we also saw the anions. What are the anions which are more inside the cell? Yes, please, that is going to be your phosphate and proteins. phosphates and proteins, they are going to be more inside the cell, which are negatively charged. Now, there was one MCQ came in the NEET. What was that? Which of the following divalent cation more inside the cell? Divalent cation. If they just ask which of the following cation is more inside the cell, the answer is very, very clear. It is going to be potassium. But if I ask you which of the following divalent cation, potassium is monovalent, right? So it is not the divalent cation. Yes, it is most abundant cation, but it is not divalent. So if they ask divalent cation, then your answer will be magnesium. Please remember, it is not calcium. Calcium is more outside the cell. All right. So please remember, calcium is more outside, and divalent cation, that is more inside the cell, that is going to be magnesium. All right. Now let's talk about ECF. ECF में who is more? ECF में who is more? Tell me. फटाफट से बताओ, whomsoever is online. Just don't do the passive learning. Just try to incorporate your knowledge here. Remember that when we were amoeba, at that time, we developed inside, unicellular organism developed inside the seawater. Still now, we require the salty environment outside of our cell, right? Because the seawater is a salty water, it is not a sweet water, right? So now also, when we developed into such a huge multicellular organism, still we require the same environment for nourishment of our cell. That means outside my cell, in the extracellular fluid, I have more salts. Salt means sodium and chloride mainly. Sodium is a positively charged ion, chloride is a negatively charged ion. So I'll write it like this. All right. And very good, Angel, Ashish. Now, I just now told you that the calcium is also more outside the cell, as well as bicarbonate is also more outside the cell. So please remember these things. If you feel this is too much to remember, at least remember 4 things. That is, first is your potassium ion, sodium ion, calcium ion, and chloride, because all of the nerve muscle physiology roam around these 4 major anions and cations. All right, so please remember at least these 4 things. All right, if you understood this, let's move on to the equilibrium potential. We have already discussed that I'm going to put 2 electrode. One is the surface electrode on the surface of the cell membrane, and one is the micro electrode, which is going to go just inside the cell membrane, and it is going to measure the potential difference, the magnitude of potential difference between these two, right? And that is going to be coming into the voltmeter. So please remember the magnitude of the potential difference that I'm going to get when in this case, potassium movement stop. Any ion movement is going to stop. At that time, this will be called as equilibrium potential. Whatever magnitude of potential I have gotten here, when the equilibrium has been achieved, when this is going to happen, when the concentration gradient and electrical gradient, they are equal but in the opposite direction. At that time, the potassium movement will stop, or a particular other ion, if you are studying about, the other ion movement is going to stop. That means it is at equilibrium state. That means the concentration and electrical gradient, they have matched with each other, and that is known as equilibrium potential, which was given by Nernst. He was the scientist, so that's why we can call it as Nernst equilibrium also, or Nernst potential also. Equilibrium potential, Nernst potential, or Nernst equilibrium, one and the same thing. All right. Now, please remember, this is only measured for single ion. You cannot add multiple ions, and you cannot measure Nernst equilibrium at a time for multiple ions. So you cannot calculate the RMP with this, because at the resting time, multiple ions are going to move inside, outside, right? You cannot just talk about the multiple ions over here. So RMP cannot be calculated by the Nernst equation. What we are going to calculate with the Nernst equation? We are going to calculate the equilibrium potential. That's all. All right. Now, what is the formula for this Nernst equation, or what is the formula for equilibrium potential? Let's see. When I have to measure the equilibrium potential, the formula comes out to be RT by ZF, natural log of concentration outside upon concentration inside, right? But What are these? R, Z, F, T. Let's see. The R is the gas constant. What about T? T is the temperature, which we also keep constant, room temperature. Z is the valency that depends on which ions you are studying, and ZF, F is the Faraday's constant. So if you're doing the experiment in a particular temperature, we are going to keep the temperature also constant. Everything is going to be constant. See over here, this is the gas constant. So one constant is there. This is also Faraday's constant. That means particular value is going to be there. Except the valency, all the things are going to be same. And natural log is difficult to calculate, right? So what we are going to do, we are going to convert that into log 10. Log 10 is very easy to calculate. All right. So the formula will become, the easier form of formula will become, if you calculate R, T and the F, and you calculate that, that comes out to be around 61. So please remember 61 upon Z, and I told you that the log 10 is easier to calculate. So I'm going to take the log 10, concentration outside upon concentration inside. All right. So CO and CI is the concentration outside of that particular ion upon concentration inside. Concentration outside upon concentration inside. All right. So please remember, this is none other than the equilibrium potential. All right. And that's how you're going to calculate it. Okay. We're going to solve one question regarding to it. Let's see whether you are able to solve this question or not. Negative ion concentration is 100 millimole per liter outside. That means they have given me the concentration outside, that is 100 millimole per liter, right? And concentration inside is also given, that and the 10 millimole inside. That means this is the concentration inside, and we have to calculate the Nernst potential. All right. I know that this is the negatively charged ion. Can you calculate? Take a moment and calculate yourself. If you cannot calculate, I'll tell you the formula. And how to calculate it. क्या लगाओगे if it is negatively charged ion and they have not discussed whether it is divalent, trivalent, monovalent, nothing. We are going to assume that they haven't talked about that. That means it is going to be monovalent, like chloride, bicarbonate, like that. All right. So since it is a negatively charged ion, I'm going to write the -1. Why? Because on the top of it, it will be negative ion. That means like a chloride and bicarbonate, it is going to have negative charge on the top of it. All right. So that's why I have to write -1. If I write positively charged ion, then I'm going to write +1 into the at the place of the denominator at the level of Z over here. Now, log 10 of concentration outside, that is 100, and concentration inside, that is 10 millimole or milliequivalent per liter. All right. How much it will be? -61 log 10 of 10. Right. Now, how to calculate log 10? It's pretty easy. You just have to calculate the number of 10, number of zeros. If the number 10 is there after 1, that is going to be, the value is going to be 1. If I ask you what is the log 10 of 100, there are 2 zeros, the value is going to be 2. If it is 1000 value will not come, but if comes, it is going to be 3. Let's say it came somewhere between 1 and 2. Or 10 or 100. Let's say it came out to be 50. Have to apply your knowledge, or you have to apply your logic. That is going to be 50. Good evening, Moon Official. So that is going to be, over here it is 10. So log 10 of 10 is going to be 1 because only 1 0 is there in the 10. So -61 into 1. That is going to be -61. It's going to be the right answer because it was a negatively charged ion. If you apply your brain, it is more outside. Definitely it is going to come inside. And whenever the negatively charged ion going to come inside, it is going to make the cell negative, right? Easy peasy. All right. So let's see. First of all, how what I just now said. For example, let's say, for example, we have discussed the example of potassium, isn't it? Let's say this is a channel of potassium. Potassium is more where? Potassium is more inside the cell. Where it wants to go? Of course, it wants to go outside the cell because the concentration gradient is there. Now understand, if I start removing the potassium, which is a positively charged ion, what will happen? Of course, it is going to take the charge with it. ऐसा तो नहीं करेगा that it will leave the charge in the cell and go outside. That is not possible. It is going to take that positive charge along with it and then it will go outside. That means my cell is going to lose the positively charged ion. That means it is going to lose the positivity. If the positively charged ion moving outside the cell will become negative, right? It is going to be negative as compared to before, right? So cell will start building up the negativity. Now, if I ask you, there was a negatively charged ion, but it was more outside, what will happen? Any example do you remember? Chloride, right? So if the chloride start to come inside, what will happen? Now, chloride is a negatively charged ion coming inside the cell. That means when it is going to come inside the cell, it is going to bring its negativity with it or negative charge with it. What will happen to the cell's polarity? Of course, the cell will become even more negative. Why? Because the negatively charged ions, they are coming inside the cell. So please remember, the cell potential is going to be negative. So if I have to talk in terms of synapses, it is called as IPSPs, all right? So potassium efflux, if something is exiting out, I'm going to call it as efflux. If something is coming inside, that I'm going to call it as influx, all right? They're going to make the cell potential negative, go in the negativity. Then, excuse me for my health. Now, if I talk about another ion channels, let's say the positively charged ion, which is more outside, that is calcium and sodium, both are more outside the cell. And when I'm going to open the channel, whether it is of sodium or it is of calcium, what will happen? Those sodium or calcium, they are going to come inside the cell. As soon as they start coming inside the cell, what will happen? Definitely, when they start coming inside the cell, they are going to make my cell positive, isn't it? So they are going to make my cell positive. So if I ask you, and they are coming inside the cell means whether it is sodium influx or the calcium influx, they are going to make the cell positive. All right. Now there is one terminology which is known as synapse. What is synapse? Synapse is the communication between two neurons. It is the communication between two neurons. Okay. Whenever I'm going to have the synapse, what will happen? If I talk in terms of synaptic potential, if I open the potassium channels or chloride channels at the postsynaptic membrane, it is going to generate some potential, and that potential is going to be negative. And usually the negative potentials are going to generate the hyperpolarization, and this is called as inhibitory postsynaptic potential. So if I ask you, the IPSPs are generated by, what is IPSP? Inhibitory postsynaptic potential. Right? And what is EPSP? It is excitatory postsynaptic potential. Inhibitory postsynaptic and excitatory postsynaptic potential. So tell me, who is going to create IPSP? Of course, the IPSP is created by the potassium efflux or chloride influx. What are the examples? Examples are GABA A channels. GABA A channels, they are going to open the chloride channels. GABA A are nothing but when the drug is going to act on the GABA A receptors, they are going to open the chloride channels. When the chloride channel opens, of course, the chloride is going to come in and that is going to generate the IPSP. What about GABA B channels? GABA B, you can say receptors. They're going to open up the potassium channels. The potassium will start going outside the cell. It is again going to produce the hyperpolarization. We give the drugs such as benzodiazepine. Benzodiazepine is going to activate benzodiazepine. They are going to activate the GABA A receptors and they will cause the decrement in the activity of the you can say neurons. So whenever the patient is suffering from anxiety, we are going to give this you can say drugs. And if the patient is suffering from muscle spasm, we give the baclofen. The baclofen is going to act on the GABA B receptor, which is again releasing the potassium outside the neuron, and which is going to decrease the signals which are or action potential which are generated in the nerve, so that the muscle can be relaxed now without any stimulation. All right, so please remember that. And same with the EPSP. EPSP is generated because of the sodium or calcium influx. Sodium influx is going to occur at the NMDA receptors. NMDA receptors. What are the NMDA receptors? These are the receptors which are going to be present in the hippocampus, which are going to help us out, especially to the doctors. Why? Because we read so much, right? We have to remember so much. So please remember that helping you in the memory generation. What happens when the drug acts on the NMDA receptor or neurotransmitter which is going to act? That neurotransmitter is nothing but glutamate. Please remember, all of that is potential MCQ. Glutamate is going to act on the NMDA receptor, and as soon as the glutamate acts on the NMDA receptor, the sodium channels are going to open up, and that's how your signals are going to be generated in the postsynaptic neuron, and that neurons have the synaptic connection with the previous neuron, and that's how the synapses are formed inside the hippocampus, especially the CA1 type of neurons, and that's how the memory is going to be formed. All right, so please remember that. And in the pain pathway, substantia gelatinosa, that is rex lamina number 2. In that, what happens when the pain is stimulated at the nociceptors are going to be stimulated because of the pain, they are going to carry the information towards the spinal cord. As soon as they reach to the spinal cord, rex lamina number 2, that is substantia gelatinosa, over there, when they synapse with the second order neuron, at that time the calcium channels are going to be opened, and because of that I'm going to have the sensation of pain, because the second order neurons are going to get activated because of the calcium influx, and they will carry forward the sensation of pain to my thalamus, and from the thalamus it will go finally towards the somatosensory cortex. All right, so please remember all these examples. Let's move on. Let's see what are the effects of these ions on the RMP. If I say that potassium is normal in the you can say the patient, then RMP will be also normal. But what if I told you that there is something known as hyperkalemia condition is there in the patient? Now see, if you break down the terminology, EMEA literally means blood. EMEA literally means blood. You must have read about hyperkalemia, hypocalcemia, hypercalcemia, hypernatremia, uremia, anemia. What is this EMEA? EMEA literally means blood. So please remember, hyperkalemia. Hyper means increased, right? Hyper means increase, and K is for potassium, and EMEA means blood. So that means the blood potassium levels has been increased. So please remember, blood potassium levels has been increased. So please remember that hyperkalemia means in the blood I have more potassium. So let's say a patient came to you. This is the patient's cell, and let's say this is the blood vessel. Usually the potassium goes outside the cell into the blood, of course, right? Because that is the tendency of potassium. Potassium is the ion which is more inside the cell, right? We usually call it as cell is a bag of potassium, right? भर भर के पोटेशियम होता है. But if I increase the potassium inside the blood, what will happen? Now less potassium will go outside, right? Less potassium will go outside. Hyperkalemia is there, so delta C is going to decrease. Already you have more potassium in the blood, so more potassium from the cell will not go into the blood, right? So what will happen now? Because of the hyperkalemia, less potassium will move outside. Less potassium will move outside, and if less potassium moves outside, that means more potassium will accumulate inside the cell. More potassium is going to accumulate inside the cell, and potassium is a positively charged or negatively charged? Potassium is the positively charged ion which is accumulating inside the cell. What will happen to the cell polarity? The cell polarity will become more positive. The cell polarity goes towards more positive, right? And if the cell polarity becomes more positive, that means we are going away from the normal negative polarity. That means the cell is getting depolarized. So actually the depolarization is not happening. Rather, we can say that the better terminology is the cell become more excitable. The excitability of cell is going to increase. The excitability going to increase. Vice versa is going to happen if the hypokalemia is there. Hypokalemia means less of the potassium is there. What will happen? More and more potassium from the cell is going to go in the blood. And if more and more potassium is going to go in the blood, in the reverse condition, what will happen? Less potassium will be there in the cell. The excitability of the cell is going to decrease. But there is a trick. What is the trick? Medicine इतनी आसान होती तो सारी कर लेते है ना? If the medicine would have been that easier, everybody would have done that, right? It is not a game, right? So always there are going to be twists and turns. Please remember, hyperkalemia has two types. First is mild to moderate. The thing which we discussed is mild to moderate hyperkalemia, right? And there is going to be severe hyperkalemia. In this case of severe hyperkalemia, what will happen? In the case of severe hyperkalemia, please remember, the potassium levels are way too high in the blood. Now what will happen? More and more potassium is going to stay inside the cell. The cell polarity remains positive for a longer time, right? So since more and more potassium accumulation is for the prolonged time, so the cell will be persistently depolarized, right? So there is a phenomena which is known as accumulation for the prolonged time, and that is going to lead to something known as persistent depolarization. Persistent depolarization. And when the depolarization is persistent, that will inactivate the sodium channel. Inactivation of sodium channel means whenever you're going to give the stimulus, the sodium channel won't open. And if the sodium channel won't open, there is no use of increase in the excitability. Rather, the excitability has been decreased. Why? Because even after giving the stimulus, the sodium channels are unable to open because of this persistent depolarization, the sodium channels got inactivated. वो नाराज हो गए. They got upset that why you are doing the depolarization. It's our job, है ना? So please remember like that the sodium channels are going to be inactivated, right? And because of that, in the severe hyperkalemia, what will happen? The excitability of the cell is going to be rather decreased. So किसी भी चीज का अच्छा नहीं होता, right? बहुत ज़्यादा अच्छा नहीं होता, alright? So nothing is good if it is way too much, happening way too much, alright? All the cell J, It is about all the cell. Okay, just when I talked about the IPSP and EPSP, that was about the neurons. Okay, we just took the example of junction of two cells. All right, that is nothing but junction of two neurons. But this is going to happen in all the cells. All right, if that would have been a neuron, I would have drawn the neuron. I hope you understood this. All right, so please remember, अगर पूछा गया क्या mild to moderate hyperkalemia, it is going to be increasing the excitability. If they ask severe hyperkalemia, then it is going to decrease the excitability of the cell. What about calcium? Remember, the calcium is a guard of the sodium channel. That means it won't allow the sodium channels to come inside in the excess manner. All right, that is important. Otherwise, way too much depolarization is going to take place. We don't want that, right? So that's why the calcium should be controlling it. So calcium acts as a guard. All right, so it is known as membrane stabilizing agent. For cell. Membrane stabilizing agent for cell. Now please remember, if it is a membrane stabilizing agent, that means it won't allow the sodium to come in excess into the cell. So if there is much more serum calcium, serum matlab again the blood minus cells, it is going to be your this serum. All right, plasma, and plasma se bhi hum, there is some clotting factors we are going to remove, that is going to be serum. Usually we write it as increased serum calcium, that is hypercalcemia. If hypercalcemia is there, what will happen? It will decrease the sodium permeability. All right, so it will decrease the cell excitability. But if it is decreased in case of hypocalcemia, I'll write it like this so that you can understand both are the same thing. If serum calcium is increased, what you're going to call it as? Hypercalcemia. Calcemia. Cal for calcium, right? Emia means for the blood. Hyper means more. Over here, we are talking about hypo means decrease serum calcium, right? So decrease serum calcium is known as hypocalcemia. What will happen? They will increase the sodium permeability. Because the guards are not available, so more and more sodium will come, and that will increase the excitability. So that is going to increase the sodium excitability, the membrane excitability. All right. What about sodium? See the meme, what the meme is saying. I don't always influence membrane potential, but when I do, I make an action potential. That means sodium is not going to affect the RMP. All right. So if they ask specifically about sodium, has no role. Sodium alone has no role in RMP. So whether it is hypernatremia, hyponatremia, doesn't matter. It doesn't matter. Why? Because it is not permeable during the rest. It is not permeable during the rest. All right. So I'll write it. It is not so it won't change any or it won't have any effect on the RMP. It won't have any effect on the RMP. All right. Now, if I have to measure the RMP, how can I measure the RMP? I told you that the equilibrium potential can be measured by Nernst equation, right? RT by ZF log 10 of concentration outside upon concentration inside, all right? Or 61 upon Z log 10 of concentration outside upon concentration inside. Now, if I have to measure the RMP, what I need to do is, Nernst equation was for the single ion. I want to collaborate all the ions which are going to be there and how much they are permeable during the rest. All right, so that I need to calculate, and this equation was given by the RMP can be calculated by something known as GHK equation. What is GHK? Goldman-Hodgkin-Katz equation. It is nothing but Goldman-Hodgkin-Katz equation. Goldman-Hodgkin-Katz equation, he gave the formula for the RMP. Now, what you need to do is you have to calculate the Nernst equilibrium for all of the ions and you have to multiply with their own permeability. Once you have done that for one ion, you have to summate such many ions. So, the formula for RMP, I can write it as summation. It's the sign for the summation, right? Let's say you have 4 different ions, any ions you can take, right? So EP of X ion into its permeability plus EP of Y ion into its permeability of Y ion, right? Plus EP of Z ion into permeability of Z ion. So many ions, whatever ions you have to do the summation of all those ions. Let's see sodium permeability का क्या scene है. So P is for permeability over here. Is the sodium permeable at rest? No. So if I calculate whatever the EP of the sodium is there, I'm going to multiply it by sodium's permeability. Sodium is not permeable at rest, so the permeability of sodium is 0 at the rest. So whatever the EP is there, if I multiply anything by 0, it will come out to be 0. And that's why we have written there that the sodium is not at all permeable during rest, and that's why it has no effect on RMP. On the other hand, yes, the potassium is fully permeable. For that, we should know what is the equilibrium potential of the potassium, right? So let's see. You can just remember this name of the equation, that is Goldman-Hodgkin-Katz equation. And 2 things you require for that: equilibrium potential and the permeability. All right. Let's move on to the EP and RMP. EP, equilibrium potential. Equilibrium potential of the sodium. How much it is going to be? Please remember, when the sodium and the calcium, they are going to move, they are going to make my cell positive. So I'm going to write positive over here, right? And when the chloride is going to move inside or potassium is going to move outside, of course, they're going to move along with their concentration gradient. They're going to give my cell the negativity. So I'm going to write it as negative. All right. Now, let's see what is the equilibrium potential of sodium. S for sodium, S for 60. Please remember S for sodium, S for 60. Calcium is going to have the range. It is almost double that of the sodium. So that is going to have the value of 100 to 130. It is going to have the range, that is millivolt. Of course, it is the potential. We are going to talk in terms of millivolts. All right. What about chloride? Chloride. After the sodium, the chloride is going to come. Sodium chloride, they are very close. It's just that they're going to give the opposite effect. Why? Because their potential is, or their charges are opposite. All right. Minus 70. And the potassium is going to be minus 90. Potassium is going to be minus 90. How to remember? Remember sodium, chloride, potassium, calcium in that order. All right. And remember 60, 70, 90, 110. 60 के बाद 70 आता है. Add 20 into it, that will become 90. Add 20 into it, that will become 110. Easy for the remembering purposes. Coming on to the neurons, but make sure that you have written the correct sign in front of them. Coming on to the neurons, if I measure the RMP of neuron, that is going to be minus 70 MB. You have to remember these are the factual things, right? Skeletal muscle and cardiac muscle, they are going to have the equal, you can say RMP, that of the equilibrium potential of potassium, that is minus 90 MB. What about smooth muscle? It is going to be minus 50 MB. And what about the SA node and PER, that are nothing but the pacemaker cells of the GIT, which are interstitial cells of Cajal. They're going to produce some basal electrical rhythm at the rest. They are going to have the non-stable RMP. That means it is not going to be a single value. It is going to be a range, and that range is minus 40 to minus 60 or minus 60 to minus 40 MB. Right? So it is going to be a fluctuating RMP. It is not going to be a straight line stable RMP. The potential is going to move between minus 60 to minus 40 throughout when I'm going to talk in terms of the pacemaker cells of the heart or the GIT. All right, BER is basal electrical rhythm. Yes, Jay, you are absolutely correct that the RMP has some role. I'll come on to that. The next topic is that only, that the sodium potassium pump, how it is going to help us out. All right. Total charge is going to be depending on how much permeable a particular ion is. And that's what we are writing over here, Jay. If you take the neuron, it is not going to be 0. It is going to be minus 70 because there will be some ions which are not going to be diffusible. And if you have all the ions which are diffusible, or you should require that none of the ions should be permeable. In these two scenarios, I'm going to have a 0 RMP, which is not there in any of the cell. Cell will have some RMP. The least RMP is of RBC, if you want to remember. That is going to be minus 8 to minus 12. It is the least excitable cell. All right. So it is never going to be 0 only if all the ions are permeable or none of the ion is permeable. In these two conditions, either the P is going to be 0 for everyone or P is going to be 1 for everyone. Then what will happen? All the negatively charged ion can come inside. The negatively charged ion can go outside also. They will balance each other and then the RMP can be 0. Otherwise, the RMP is not going to be 0. Why? Because your cell membrane is going to show the partiality in all the cells. All right. EPSP, IPSP, we have already discussed that IPSP is because of the potassium efflux or chloride influx, and EPSP is because of the sodium or calcium influx. All right. So that is about the EP and RMP. Now, as the Jay said that the genesis of RMP, who contributes maximally? It's the potassium more than calcium, the chloride, and there is a little contribution of our Nokia pump, that is sodium-potassium ATPase also. Now, what the sodium-potassium ATPase is going to do? Suppose this is the sodium-potassium pump. What it will do? It is going to throw the 3 sodium outside and take 2 potassium inside. That means, let's suppose that I gave 3,000 rupees to you. You're going to give me 2,000 rupees in return. So, I'll be in the loss of 1,000 rupees. Right? Same happens with the cell also. The cell is giving 3 positively charged ions outside, but instead, in exchange of it, it is getting only 2 positively charged ions. Right? So if I write over here 3 positive out, so there is a loss of 3 positive, right? Only 2 positive came inside. So there is a net loss of 1 positive, or I can say there is a gain of 1 negative. Right? 1 extra negativity is going to be there. So that's why the RMP, you must have seen the RMP of all these cells. I have written everywhere negative, negative, negative. Why? Because you move potassium outside, you move chloride inside, or you activate the sodium-potassium pump. Everything is helping my cell to become negative. So please remember, almost all the cells are going to have the negative RMP during the rest. Negative RMP during the rest. So normal negative polarity is going to be there inside the body. And this pump, why it is pump? Because when it is going to move anything, it is not moving through the channel, but it requires the energy. It is moving it through the pump, and that's why it is known as the ATPase. Why? Because it is going to break down the ATP and going to do this change, which is going to be there. So Nokia, that means Nokia. Why I have said Nokia? It is going to throw 3 sodium out, take 2 potassium in, and it is ATPase. And that's why I called it as Nokia pump. All right. And because of that, if they ask about the coupling ratio, they will ask you what is the coupling ratio of it. You know that sodium is having 2 alphabets, add 1 into it, that will become 3. Potassium is 1 alphabet, add 1 into it, that will become 2. So 3:2 because sodium comes first. So 3:2 is the coupling ratio. It is going to have some minor role, right, in the RMP genesis because it is building up the negativity inside the cell. माइनर रोल ऑलमोस्ट 5 to 10% का रोल होता है बस इसका. ऑलराइट. Okay. Now, if I say that this pump is active during the rest, and that's why we are talking about this pump in the RMP, isn't it? All of your cells, they are going to have this pump. All of your cells, they are going to have this pump, and this pump is active all the time. Let's say you're not doing anything, you're lying on your bed and you're chilling out, you're relaxing. So at that time also, this pump is going to be active. And this is using the ATP all the time. So that means whatever minimum use of ATP is going on, that is because of this pump. So I can say that the basal metabolic rate, that means whatever ATP utilization is happening, that is dependent on this pump. So that is the basal metabolic rate is going to be dependent on this pump. So that's why maximum ATP consumption at rest or at the basal condition is going to be dependent on this pump, and that's why the BMR is also dependent on this pump. What will happen to the BMR as the age progresses? The efficiency of this Nokia pump is going to come down, and that's why the BMR decreases, and hence you must have seen the elderly people, they are going to eat less. Why? Because their Nokia pump is not properly working. They don't need much of the food because their metabolism has been reduced too. All right, this Nokia pump, if I am going to zoom it out and see how it looks in the electron microscope, this will look something like this. It is going to have two subunits. What are the two subunits? Alpha and beta. Now see, there are binding sites of these, you can say on the alpha chain, there are 5 binding sites, and all of the 5 binding sites, they are going to be present on this alpha subunit. What are the binding site and what is the mnemonic? Remember the mnemonic OK nap. OK nap. If you are tired, okay, take a nap and come back. Okay, what is OK? O for Wobben binding site, where your digoxin, digitalis, this is going to act. These are the drugs. You'll see that in the second year. And OK, K for potassium, nap, N for sodium binding site, A for ATP binding site, and P for phosphorylation site. So please remember, all of these 5 binding sites, they are present on the alpha subunit. Then what is the role of beta subunit? Remember B for B. That is, it is just there for beautifying it. That means it is just there for the glycosylation. So what you are going to see over here, what you are looking at, this is the glycosylation points. It is going to get glycosylation, but the beta is very, very important for the activation of alpha. If the beta is not there, it's useless pump, right? We require the beta just for the glycosylation and the activation of alpha. But remember, all the binding sites are present on the alpha and alpha only. Let's see the last point. What are the stimulators of the sodium-potassium pump? Remember the stimulators. You can remember the mnemonic Tika. When you go to do some good things, your mother or someone applies you the Tika. So remember, the mnemonic is also Tika over here. What is Tika? Thyroid, insulin, catecholamine, and the aldosterone. Now, there are 2 ways to activate this pump. Either you can increase the number of these pumps, or you can increase the activity of this pump. The thyroid is going to act on the genetics, and it is going to increase the number of the pump. On the other hand, insulin and catecholamines, they are going to increase just the activity. They are not going to increase the number of the pump on each of the cell. They will just activate the pump even more. Right? What about aldosterone? It is going to activate both. That means it is going to increase the number also, acts on the gene, produce more sodium-potassium ATPase on each of the cell, as well as it is going to increase its activity. Whatever activity was going on, it will stimulate it. About the testosterone, which is present in the male, testosterone is going to have the dual role. In the low concentration or normal concentration of testosterone, that will stimulate the sodium-potassium ATPase. You must have seen that generally the males have more BMR as compared to females. Why? Because they have the testosterone. But if the testosterone is present in the high dose, or you have given the testosterone in the high dose, definitely it is going to decrease the sodium-potassium ATPase activity, which will decrease the BMR. So there is a dual role which is going to be present of the testosterone. All right. So please remember that. If I talk about the inhibitors. Please remember digoxin, digitalis. These are the drugs that you're going to see, which are going to directly act or bind to the Wobben binding site and act on this sodium-potassium pump, and they will inhibit the sodium-potassium pump. Then you have the diuretics. Some diuretics also going to block this pump, and something known as atrial natriuretic peptide. That is also going to block this pump. All right, so please at least remember all these things. All right, so that is all about the RMP. In the next class we will continue with the AP. All right, so I'll end the class over here because we have done with the time. So success is not the destination, but a series of small wins along the journey. Celebrate each one of the success. So you have successfully completed today's lecture. Thank you so very much for giving me a proper response, right? And I hope this response increases day by day. I'm hopeful for that, and I have successfully completed the lecture, right? And that's why I'm going to celebrate my small win. So that is all from my side, guys. So yes, please remember that if you have any doubt, you can ask me on physio _ Pooja. That is my Instagram ID, or you can ask me on the Cerebellum official group. You can join the Cerebellum official group on the Telegram. You can just ask me there whatever doubt you are having. That's all from my side. Thank you very much. Bye bye. Take care.